Imagine waking up one morning, going to the mirror, and seeing a stranger looking back at you. You don't recognize your face. Your friends, your loved ones, nobody can recognize you. This sounds like a nightmare, doesn't it? But that's exactly what happens to my patients when they lose their voice, because our voice is our second face. Science tells us that we can recognize somebody's voice in 1/3 of a second if we know them. This means that in a heartbeat, the brain can process the voices, emotion, confidence, gender, personality. That's a lot. So when a singer loses her voice, or a teacher loses her voice, or a cancer survivor loses their voice, they don't just lose a tool of communication, they actually lose a part of their soul. I am Dr. Nupur Kapoor Nerurkar, and I work in a hospital where I'm looking into a thin, narrow corridor at people's voice boxes. That's what I do. So basically, my patients very often ask me that, why? Why would you suddenly lose your voice? How can this even happen? So if we were to answer that technically, it's because our voice emanates from our vocal folds, which are basically two really tiny ribbons of tissue, about 20 millimeters in length. And these tissues, they come together, and our expiratory air kind of gets them into motion. And the motion of this vocal fold, which is really super fast, like 100 to 400 times in a second, is what creates the sound or our voice. But sometimes in human beings, technology or the mechanics go wrong. And that's when it results in a loss of voice. Imagine a situation where you get a viral infection overnight and one vocal fold gets paralyzed. Like a person's body can get paralyzed, your vocal fold can get paralyzed. And then you have this huge gap between the two vocal folds. So the air leaks out and the person's voice cannot be heard. Now, many years ago, this was a huge problem. Now, of course, with the advances, we can do various surgeries. We can put an implant so the vocal fold can get medialized. We can take a special stitch. Which is also going to help get the vocal fold in position. But usually we wait for 6 months to do any of this because we're waiting for spontaneous recovery. But in today's day and age, we don't wait. We just do a simple injection into that same place, into the paralyzed vocal fold, and that injection can just get the vocal fold into a correct position. And what is this injection? It's basically just a filler. Like people use fillers for cosmetic reasons, that's what we can do. And instead of a facelift, you've got a voice lift. So let me give you an example of this.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8.
This is immediate.
2, 3, 4, 5, 6, 7, 8, 9, 10.
But this doesn't happen to so many patients of mine. Let me share another situation with you, if I may. I had a lady, a professor, who came to me with a loss of voice for 10 years. For 10 years, she had this strained, spasmodic voice. I want you to hear what she sounded like. This is her voice.
फिर से एक बार जोर से बोलिए।
Does doesn't it sound like her soul is trying to break the shackles of a locked door and come out? She was told by all her friends and loved ones that this is just stress because there was no growth on her vocal folds, there was no paralysis. So it's all stress. So she lost her job, she lost her joie de vivre of living, and she became a social recluse. And then she came to me 10 years later, and I diagnosed her with a condition known as spasmodic dysphonia, which is also called laryngeal dystonia. It's a neurological glitch where the wiring goes wrong from the brain. And I told her that you just need a drop of Botox injected into your vocal fold and you'll get your voice back. And she wasn't just relieved, she cried because, for her it meant the world can now hear the person who she is once again after 10 years. And we weren't really just treating a muscle, we were giving an identity back to the individual, we were giving a job back to a teacher. So it really changed everything for her, and I want you to hear an example of how Botox, which is a neurotoxin and a poison, can really be our friend medically. So I'll have you hear the voice of a patient of spasmodic dysphonia.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Singing.
1, 2, 3.
And now after Botox, maybe 3 weeks later,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
so this is not due to stress, it's neurological. But this doesn't mean that stress can't play crazy things with your voice. Stress can do a lot to your voice also. So I think the importance is correct diagnosis, otherwise you're not going to be going the correct garden path. Let's hear the voice of a lady who lost her voice just due to stress, and this is what she sounded like.
1, 2, 3, 4, 5, 6. अभी एक बार करो.
Now here, the speech therapist or the voice therapist is really useful. You don't need a surgeon. My therapist was talking to her. She worked with her for 30 minutes. And half an hour later, just half an hour later, no medicine, this is what she sounded like.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday.
So variable things can happen to patients, and this can change their voice, and we want to restore it. But sometimes we have individuals who don't need a voice restoration, but they feel that the voice they have just doesn't belong to them. I'd like to request you all to close your eyes for a minute, maybe, and just hear the next voice which is talking to me.
Hi, good morning, doctor.
So you're ready for your surgery this morning?
Yeah, absolutely.
Can I have you say 1 to 10, please?
Sure.
Go ahead.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Wonderful. Just say a long E for me, please.
E.
So what was the gender of the voice that you heard? You can open your eyes now. So this is basically a male who's got a very high-pitched voice, and every time he speaks on the phone, he is so distressed because everyone calls him madam. And in this particular situation, it's because of a condition called puberphonia, where you can hold your voice, your whole voice box a little high, and then your pitch goes high. So it's just wrong conditioning. Again, the therapist can work wonders with this condition, but sometimes the condition becomes a little obstinate, especially in the older males, and then we do a simple surgery under local anesthesia to relax the vocal folds. And let's hear what he sounded like after the surgery I did on him.
2, 3, 4, 5, 6, 7, 8, 9, 10.
So nobody called him madam after that. That was one good thing. with my work in the transgender population, the one thing I've realized is that the trans persons, whether they're trans men or trans women, they can change their appearance, the clothes, their face, but unless their voice matches what they feel they are, they are living a life which is quite miserable because they have then vocal gender dysphoria. And I operate on trans women to change the voice from masculine to feminine. And my canvas of surgery is as small as a thumbnail maybe, but the change that it creates is such that the trans woman feels that she is hearing her voice her original voice for the very first time. And the amount of gratification that brings is amazing because their second face now actually matches their soul. So it's really a soul-touching surgery. If I may share an example with you.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
4 हफ्ते पहले की है वेंट्रस ग्लोटोप्लास्टी। आपको कैसे लग रहा है आवाज?
सर्जरी करने के पहले मैं तो बिल्कुल भी हैप्पी नहीं थी मेरी वॉइस से, फर्स्ट ऑफ ऑल तो यही। और सर्जरी करने के बाद में मुझे खुद इतनी एक्सपेक्टेशन नहीं थी कि इतना जल्दी रिकवरी हो जाएगा और मेरा फुल्ली फीमेल का वॉइस आ जाएगा। ओके, बिकॉज डर तो बहुत सर बैठ ही गया था। करेक्ट। बट 3 वीक्स में ही मुझे बहुत ही अच्छा, मतलब 100% में से है ना, मतलब 98% मुझे रिजल्ट तो मिल ही चुका है।
Lovely, lovely. So restoring voices gives a lot of joy, but transforming voices to create a metamorphosis gives sometimes an even greater joy. So regardless of if you're a singer who needs your voice for your profession, or you're a teacher who needs it for your livelihood, or you want your voice to match your gender, whatever the reason be, a lot is held in the balance of those tiny vocal folds, which are just 20 millimeters. And I think we need to realize that our voice is not just sound that we are creating. Our voice is our communication with the world outside. It is actually a signature. It's a vocal signature of ours. And I would like you, the next time you talk, to think about this and to respect the vibration of your vocal folds and realize that it is your signature and that, yes, our voice is our second face. Thank you so much.